and social entrepreneurship for Catholic Charities USA. And I'm here today not only in that role, but also as a member of the steering committee of SEEK. So for those of you that are not familiar with SEEK or are not involved in some way, we want to just encourage you to get to know the group a little bit more. SEEK is a non-incorporated group. It's a global network of institutions and investors that are seeking to expand the practice of impact investing among Catholic institutions. So we're a peer-to-peer network of investors just like yourselves that where we can come together to ask questions, to share advice, to learn from one another, and to, as we each kind of work through the process of encouraging our institutions or working through whatever kind of investments that we might have to increase those positive impacts of those investments over time. But we all know we have to navigate really practical and technical issues around this process. So we're excited to have our guests today, and we'll share a little bit more and introduce the presentation as we go. So if you're not involved with SEEK in some way, I want to encourage you to join and come out to one of our upcoming regional gatherings. We have regional dinners going on around the country over the next few months that you're always welcome to participate in. So you can learn more about SEEK and sign up to Gather's newsletter and other information about it at catholicimpact.org. That's catholicimpact.org. So today we have the pleasure of spending the next hour or so with Pam Schmidt and Ed Gerardo of Bon Secours. Whether through their investments in affordable housing or access to healthy food or job creation activities, I think you'll be inspired by the kinds of projects that they've been able to put together and the impact that they've had in the communities that they serve and work within. It's a very holistic approach, and I think we're very interested as Catholic Charities, and I know many members at SEEK have really looked up to Bon Secours for what they've been able to do with their portfolio. So as we go through this time, we'll have a fair amount of time for Q&A at the end, but feel free to chat your questions as we go, and we'll organize them and bring them up to the guests, and then we'll also open up for questions from the audience as we get towards the end of the hour. As we transition into the presentation today, it's our tradition to always really kind of center us at the beginning of these presentations with a prayer and to remind us really why we're here and why we do this work. So to begin, I want to just start off with a brief kind of reflection and prayer and a riff on a very old prayer that's attributed to St. Francis, but we maybe modernized a little bit for the conversation today. So let's take a moment just to calm our minds and remember that we're always in the presence of God, and the work we're doing has significance, particularly today. Join me in prayer for a second. Lord, make us in our organizations, our investments, instruments of your peace. Where there is hatred, let us invest in love. Where there is offense, let us invest in pardon. Where there is war, let us invest in peace. Where there is doubt, let us invest with faith. Where there is despair, let us invest in hope. Where there is darkness, let us invest in light. Grant us that we may not so much seek to be lifted up as to lift up others. Grant us wisdom to see and courage to act. We ask this in Jesus' name. Amen.
Amen.
So to introduce our guests today, I want to turn it over to Jake Barnett, a founding member of the Catholic Impact Investing Collaborative Steering Committee and an institutional investment specialist with Greystone, the consulting division of Morgan Stanley. So Jake, take it away.
Thanks, Matt. So yeah, my distinct pleasure to introduce our two panelists here today. Thank you both, Ed and Pam, for making the time to speak. Give you a brief background. Ed is the former director for community development and social investments for Bon Secours, and is now consulting with organizations on impact investment with community development. And along with his Treasury Service colleagues at Bon Secours, he established the community investment program 10 years ago. Pam Schmidt is the current acting vice president of Treasury Services for Bon Secours Health System. So as Matt said, we are going to feel free to participate and chat your Q&A at us. We'll be tracking that the entire time, and there will be plenty of time for questions at the end. In the interim, though, I'm going to turn it over to Ed and Pam.
Great. Great. Well, good morning, everyone, and thank you for having us. Ed and I are simply delighted to be here today and to share with you kind of our journey in community investing and impact investing. I want to tell you a little bit about Bon Secours Health System. We are a Catholic not-for-profit health system located predominantly on the eastern seaboard and west to Kentucky. We're founded by the Sisters of Bon Secours, who are order of religious women out of Paris, France, in the 1800s. And they were really revolutionary and very progressive for their time. They were one of the first orders of women religious to ever take health care into the home of those they needed. So much like we see today, offering home care and greater access to those we need. We're a health system of about $3 billion in revenue, $1.3 billion in unrestricted investable assets. We're in 6 states, 19 hospitals, and 5 long-term care centers. We have exciting news here at Bon Secours Health System. On May 21st, we entered into a letter of intent with Mercy Health out of Cincinnati, Ohio, to join and become what will be the largest Catholic health system east of the Mississippi River. We are a socially responsible investor here at Bon Secours Health System, and our platform really kind of has 3 legs. We have investment screens, we do shareholder advocacy, and we have our community investment program, which we'll spend the majority of the time talking about today. We really recognize that in support of our mission and support of being a Catholic entity, we need to put kind of our money where our mouth is and invest in things and promote things that do good for people, that do good for the environment, and that do good for humankind at large. We understand that we have this responsibility to steward our assets within the context of the social teachings of the Catholic Church, and making sure that what we do promotes kind of systemic change to improve the health and well-being of the communities and the individuals that we serve. Just briefly, investment screens, it's kind of an old tried and true way of socially responsible investing. We have a list of things that we don't want to invest in, and those would be things that really are contrary to the social teachings of the church, abortifacients and stem cell research. We don't invest in tobacco companies. Tobacco companies produce products that make individuals sick and drive healthcare costs up, so we don't want to support those. We don't invest in gaming. Gaming really seems to prey on those that most that can't afford it, at most kind of a social economic deterrent. And human exploitation. Our sisters are very passionate about putting a stop to labor, forced labor, as well as human trafficking. The advocacy side, while we can say we are not going to own certain things, we really do find that the advocacy side, the shareholder advocacy side, is much more powerful. It's much better to engage with a company or an organization to try to promote change, to try to promote them to see a different point of view. And we've been very successful in the work that we've done here, really partnering with our colleagues at the Interfaith Center on Corporate Responsibility and the Sisters of Bon Secours. So active engagement and dialogue, talking at shareholder meetings, really, I think, is very, very impactful and highly successful. The third leg of our stool is really our community investment program and our impact investment program. And, the goal of the program is really to make investments with institutions and or projects that promote access to jobs, housing, food, education, and healthcare for low-income and or minority communities. Really kind of, serving that whole notion of population health, which we're all fully immersed in today. I'm going to turn it over to my colleague, Ed Gerardo.
Thanks, Pam. I'm pleased to see that several of my colleagues over the years are participants on today's call, so it's always good to know, and they're supportive of our work, as I am of theirs. So on this next slide, you see a population health chart. Robert Wood Johnson Foundation was behind its creation. The reminder to us, and this is an explanation not only that our justification lies in Catholic social teaching and our mission as a Catholic entity, but more specifically as a health system. And it was with not the creation of this, but the thinking around this, is that many of the health status influences on populations are upstream from actual health behaviors and clinical care. We call those social determinants of health. Here it's represented as social and economic factors, as well as the built environment. And you can see to the right that whether it's in the area of education, employment and income, particularly the need for increased median income, family and support services, community safety, as well as the environment, these are all, to extent at least 50%, if not more, determining people's health status. So it becomes logical for us to find ways. We have our Healthy Communities program, which is intentional about working with vulnerable communities, raising up leadership to try and improve the factors, not always health factors directly, but the social determinants that can influence people's long-term mortality and morbidity. So we said, why not use our investments to make an impact on various social and economic factors? And on the next slide, you'll see here that there are plenty of opportunities for investment purposes. Again, this is another way of displaying that the community's health and wellness has at least, if not 10, at least these 10 factors, which include access to healthy foods, access to public transit and active transportation, affordable housing, economic opportunities, safe neighborhoods and public spaces, the environment's quality, and green and sustainable development practices. So many of you are probably familiar with a simple explanation where they will show that the difference between living in two different zip codes that are less than 10 miles apart can often be 15 years of age. So we wanted to use our investments as a way, or our potential investments, as a way of influencing people's access to affordable housing, to impacting food deserts, to creating green and safer environments for people. So with that in mind, it's the Bon Secours and hopefully other health systems' intention to use as many tools in the kit as possible to bring about improved health status. So I'll stop there and we'll get into the meat of the program now with Pam.
Great, thanks, Ed. So what is this community investment program? You know, I will say this is, we had a start in this right about the turn of the century, in this current century. And we made an investment through the Small Business Administration through kind of a partnership structure with a GP. And it didn't end well. The GP had some challenges, legal and just not really minding the shop as they should have. And we lost our investment. So it took us a little bit to kind of exit that. And once we did it, we had to kind of rethink how we wanted to go about this. So what we're going to talk about today was really our 10-year journey on where we are today. So, you know, our program is a decade in the making, and today we have about 30 million placed in the program, invested across about 24 different managers. And as I noted earlier, this community investment program is one of the 3 legs of our socially responsible investment platform. And we really want to invest with organizations and funds that conduct themselves in a manner consistent with the values of BSHE, of Bon Secours Health System, and also the social teachings of the church. We have a couple funding priorities that have been laid out as criteria from our executive management team. And one is we have a passion for investing dollars in our local communities where we provide healthcare or healthcare related services. And we want to use these dollars to promote healthy communities, which is a strategic initiative for the health system. And we want to make sure that the dollars we invest are impacting those that we serve. Ed, the next slide, please. Our community investment program, you know, it has several objectives. The key objective is we have about 1.3 billion of investable assets. We want to allocate 5% of those investable assets to this program, which now at 1.3 billion is about $65 million, and we are about halfway there with our 35 million. we want institutional quality type investments, diversified across managers, risk type, geography. So think about when you have a stock or a bond portfolio, you're not investing in just in Apple, or you're not just investing in JP Morgan bonds. You're investing across you want to invest across a wide array of securities and companies so that you can get good diversification. Think about that the same way here in a community investment program. You don't want to put all your eggs in one basket. When we started out in this program, preservation of capital was absolutely key, and that was probably driven by our initial foray closer to the turn of the century, and that did not end as well as what we had hoped. So we always have to tell people and remind people that we're talking to about the program. This is not a grant program. It's not a charitable donation. We fully expect to make a return on our capital, and we expect our capital to be returned at the end of our commitment. You know, we have a financial rate of return that we've set for this portfolio at 2 to 2.5%, and some may say, well, that's pretty low given, you know, the opportunity you may have in the stock market or the bond market, and that is true. But what I will say is, think about it like this: these are loans that we're making, so they're not subject to the market volatility that you would see in a stock or a bond portfolio. We're simply clipping our coupon, we're collecting our interest payments, we're collecting our principal, and we're reinvesting those proceeds on and on and on. So we kind of had, I would say, kind of a startup phase that probably lasted, I would say, somewhere probably about 7 years or so, and then we went kind of into an operational phase. We developed an internal, what we call our green revolving fund, and our green revolving fund is really to take capital projects that we have and look at those in terms of, through a lens of environmental sustainability. So investing our community and impact, our community investment program dollars, our impact investing in capital projects that will help promote sustainable environment. So water and energy. It could be changing out kind of light fixtures to new LED, very energy efficient light fixtures, changing over a heat pump to some kind of more water efficient type plan. We're also making our foray into direct investments, and Ed's going to talk to you about one of those that we've done. Ed?
Thanks, Pam. So many times people will say, and I don't know that this is the case for our participants today, many of you are already doing some sort of impact investing, but for those who haven't started it and they're wondering, well, how do I get past thinking about it? And what we've put together here is 5 kind of sequential blocks of activity, from creating a shared vision, which I'll start with. Pam will talk a little about working with finance. We'll discuss how to get more narrow and find some focus. And then we will talk about a little bit later on 2 options, either indirect investing or direct investing. And of course, you will need some documents along the way to make this happen. So let me start with the shared vision. I think for most of the participants on this call, the vision starts with the mission statement of the organization. It's what drives the organization. Sometimes organizations have very narrow visions, at least among health systems. They're particular to patient care. But I think for at least Catholic health systems and other Catholic entities, we root our mission as a much broader one, and our mandate is actually to transform the world in lots of different ways. Having said that, sometimes in the finance area, the participants, it could be a CFO, it could be other players, are very keen to accomplishing the goals and objectives of that area. So it's always important, at least from my perspective, that the organization's mission and strategies are influencing the chief executives, be they finance people or operations people. And I would say, again, in a wider organization, the impact of the board is important. So you want to have your executives on board. You want to have your board leadership in support of using your investments in this way. It's part of their overall capability and stewardship. And from our perspective, we think this has a quadruple effect. So we have an opportunity, if we do some investments, say in affordable housing, we have the opportunity to do some improvement in people's health outcomes, because now they're in a safer place and we can provide some services, healthcare services in those facilities. We're doing community development, particularly whenever we're engaged in vulnerable communities with one of our projects. Our projects normally and logically have an environmental impact, so we're either cleaning or up a vacant lot, or we're transforming some footprint. We're even advocating with policymakers about the environment. And rather than being a grant, it has the opportunity to generate a financial return. And in particular, that financial return has the opportunity in subsequent investments to keep doing good. So we see a quadruple effect with that. Pam, do you want to talk about the finance side?
Sure. So, I think we've really had a great relationship working with Ed on this program. And I think just a couple of things I would mention is it takes a little bit to stand this up and really get kind of the mechanics of it down, kind of working behind all the work of these underlying investments. And it takes some processes, establishing kind of sound processes and procedures to work through it. I think too that making sure that folks understand how this really fits into your portfolio, and that you're doing very similar due diligence on these investments as you are doing on a regular investment manager, where you would be saying to them, here's $50 million and invest in the stock market. You're doing kind of the same type of due diligence. Who's making the decisions at the firm? Do they have good governance practices? Are there policies and practices inside to safeguard my assets? Since this is a loan program, are they adequately reserved to make sure that there's a backstop should the project go bad? Ed?
Okay, this is a straightforward section finding focus. It's really not possible for all of us to do everything that needs to be done. So it's important that every organization identify areas. It could be health conditions, it could be economic conditions, it could be housing conditions. A lot of that is driven by where your organization, the population that it's serving. But the conversation actually needs to happen because there's lots of places where investments can be made, and you can find yourself, so to speak, scattered, which in some respects may be a trial and error approach, but to the extent that the conversation occurs about what are our priorities? What do we want to focus on? Is it a geographic focus? Clearly for Bon Secours, we identified 3 international communities, Peru, Haiti, and South Africa initially for investments. We recognize there are other places that needed assistance, but we thought those were places, and we look for organizations that we could collaborate with to make an impact in those communities. Secondly, I would say you need to think about your criteria for success. Clearly, Pam referenced earlier that preservation of capital was the #1 priority. We were willing, as a criteria, to take a more concessionary position with regards to the return. So instead of getting market returns, we were willing to take, 1.5 or 2.25% return on our investment. So setting out some criteria, be it financial criteria or project-related criteria, are important. And then tracking outcomes and goals is also an element of establishing success in this. So we'll move to the documents, and then we'll talk about some options.
Great. Thanks, Ed. So in terms of documentation, what I would say is it can be document intensive. So what we have found to be very beneficial for our program is we worked with our in-house legal to develop kind of a Bon Secours, if you will, model loan agreement, as well as a promissory note. And so what that does is when we enter into a new agreement with a fund or an investment, we're able to use consistent documentation. So it really makes our process internally much more streamlined. We're not having to go through individual documents each time we make a new investment. I think that is really key to getting this program stood up and really helping to streamline kind of the back office administrative work, if you will. And then I would just say, make sure you ask a lot of questions of the folks you're investing your money with. Make sure that they understand what your objectives are and what you expect to get out of the program. I think one of the things that Ed said is really key, trying to understand from them, how you get back and data back to figure out, is the investment really having the impact that you want to do? I think the other really important thing as you're kind of going through this process is make sure you understand their loan loss reserves, and ask that question of how many times have you had one of these investments go bad. Those are all great due diligence things that your executive management team, as you're presenting these forward, are going to want to know.
Thanks, Pam. I would just also mention that we created an application process for this. So we had a series of maybe 12 questions, including asking for financial documents as well as a list of board members. And then in this case, Ross Darrow and I would vet the various participants. So when we're making a loan to a CDFI or another entity, we wanted to be able to vet that organization and get a comfort level. So and we're happy to share. I'm sure Pam would be willing to share any documents that we've created. So let's talk about the various options that are available. And Pam, you want to start with the indirect options?
Sure. Thanks, Ed. So we started this program really investing through large, sophisticated third-party intermediaries. So like a Mercy Housing, a Calvert, a community housing partner, folks where they had a proven track record, they had millions and millions of dollars out in their program. We were part of a pooled fund, so the risk, if you will, is spread across a greater investment base. The other thing about it provides a lot of scale, and so your dollars can have an impact kind of on a much bigger level, if you will. And when you invest in a larger fund like that, you may not be able to get project specific, but you can at least express a desire to have your dollars attributed, as we do, to a certain area. One of the markets in which we serve. CDFIs, community development financial institutions, are not-for-profit financial institutions, and they provide great access to loans as well as to tax credits. And Enterprise is one widely known, I think, in this space that we invest with. As we developed the program and as it matured, we found ourselves really looking to smaller, less sophisticated players, just so we can continue to put money at work. I think that is one of the things that you always have to do. You have to be looking for where your next investment is going. There's also this notion of direct investments, and as we stated, we're just starting to kind of get down the path of direct investment, really where we're backing a very specific project or interest. It does have greater risk, but it also provides greater potential benefit. We could have more of a direct impact, really, of the community we serve and their health outcomes, if you will. Some options of direct investments might be a bridge loan, and we do have a project where we did that actually. We're really looking for catalysts as we do this, long-term partnerships, and we're going to talk about a multi-investor financial stacking approach. We haven't done it yet, but certainly very interested in taking that next step. And Ed's going to walk us through some of the great work that's been going on here at Bon Secours.
Thanks, Pam. So in terms of a bridge loan, this was a direct investment. And again, as Pam said, we spent several years going through financial intermediaries to preserve our capital investment. Now that we had $30 million invested, we could start to look at some opportunities. And there's an organization that does affordable housing in the Commonwealth of Virginia called Virginia Supportive Housing. They were fortunate enough to apply and get tax credits for two different projects, one in Norfolk, Virginia, and one which was a new project for affordable housing that was going to be integrated into some commercial, so it's mixed use housing. And secondly, they wished to expand on a project in Richmond, new clay housing, which has been a SRO or single room occupancy facility for the last 25 years. So while they had tax credits, many of you may be familiar in the tax credit space, is that you really don't get to draw down those funds until you get past some of the pre-development expenses. So Virginia Supportive Housing was looking in essence for a short-term loan of 24 months, actually probably less, 18 months, but we provided $250,000 over 24 months probably at 2 to 2.25%, so that they could initiate both of these projects simultaneously, so to speak. They didn't have to wait till they got one completed and had the tax credits in hand to start working on the other. So that became, from a time frame of 24 months in terms of an amount, in terms of their long and successful history in the affordable housing space, it became, I'll say, a no-brainer, a relatively safe investment option for Bon Secours on the direct lending space. Secondly, here's one of my favorite. I'll talk about the catalytic piece of this. And many of you have grant money available. And so this was a kind of a combination of both grants as well as lending capacity, as well as partners. So here is a dilapidated, for lack of a better word, and I love our sign, "Good Help is Coming Soon." Dilapidated kind of gas station, car repair place, et cetera, et cetera. It was literally across the street or within view of Richmond Community Hospital in the East End. And so we, as part of our mission to, and you've probably read in the newsletter, that we have made various investments in the East End of Richmond. So from a catalytic perspective, we thought if we could transform this property and develop it so that tenants could occupy it, creating a stream of revenue through leases, that we had an opportunity to send a signal and continue the catalytic work of transforming a vulnerable community. So this is the way it looked. And now we have the Sarah Garland Jones Center, which it's essentially the same property. It has a cafe. We've partnered with an organization that works with teenagers and young adults, and they've created an instructional kitchen. So we're teaching folks how to be entrepreneurial and create responsibility around jobs. We've identified a couple of different tenants, and we worked with the CDFI LISC, or Local Initiative Support Corporation, to provide the technical assistance and the training that's needed to be in a business plan. So we have some community program space, and we have some wonderful, here's I think the kitchen, and here you see some of the young adults that are receiving instruction on how to be in the food business. And not necessarily because of this, but many of you have probably read recently how Richmond has become a bit of a foodie capital. So if you're looking for a nice meal, I certainly encourage you to stop by the Sarah Garland Jones Center Cafe. So that was a catalytic endeavor. Again, we did some grant money around that. Not a lot. And because our grants are much smaller than our investment loans, we were able to lend money, and then we partnered with LISC and other community organizations. And I think this is the kind of stuff that all of us are probably capable of doing on whatever scale we wish. Third, and this is probably what Bon Secours is most well known for, is our housing. So for the last 20 years, Bon Secours in the west side of Baltimore has been in the affordable housing projects or spaces. So we took an initial investment of $681,000, bought 31 row houses, and made this happen after we applied for tax credits. This was some 20 years ago. But because we were able to recoup that investment, we created a revolving fund. And this is the third example, the beauty of community investments. And then we partnered with Enterprise Homes, and we've gone on to do 11 projects and created more than 800 affordable housing units in low-income communities. Our most recent set of partners have been faith communities, because they have a lot of older adults in need of residence, particularly for low-income people. And those faith communities, we've been able to create childcare centers in some of these affordable housing sites. We've created over 750 jobs for people, and we've registered more than 1,100 credit union accounts. So we're doing a multifaceted approach all around, where housing is the centerpiece of that. And that initial $680,000 has been, you could say, flipped over 11 times, and now we have over $100 million worth of project improvements in the west side of Baltimore. So Pam, do you want to talk a little bit about the multi-investor approach?
Sure. This is kind of, I would say kind of a next interest of ours. Although when I was talking to Ed about this, it strikes me as there's no one body or source out there where you could go to find someone who can aggregate all these investors together for you. So I will say this is a lot more sophisticated. It's a lot more challenging. It does pose different levels of risk and reward than simply just investing through intermediaries. So when we think about a multi-investor approach, we think about kind of, I'll start from the bottom up. We think about public dollars. So public dollars coming from cities, states, potentially grant money, maybe access to tax credits. So think about those public dollars as being the floor. They're trying to stand up this investment. And the investment could be large-scale regentrification or a rejuvenation of a certain business corridor or some blocks like we did in Baltimore with buying the Roan homes. Those public dollars are really there to help kind of support really kind of the folks in the community, ensuring that the redevelopment of this particular area doesn't force those that are live there, that are indigenous to that area, doesn't force them out of the neighborhoods and what they live in. I think that the second tier is really where we would see Bon Secours Health System kind of coming in, doing more of kind of a direct type of loan. When we think about what kind of return we would want on it, we would probably want somewhere in the 5 to 7% range. And we would want, certain criteria tied to that perhaps for us to invest, we would want to make sure that if this was an affordable housing type project, that a certain percentage of those affordable housing units would stay affordable to the folks that live in the area, or perhaps that at the end of the day, there's a community center or some type of job training program that's developed for the community. Kind of the third level of investors then are your private investors. These really would be like classic, I'll just say the word capitalists, that are looking for, a rate of return similar to that of they would find in the equity markets, maybe 11, even up to 17 or 18%. And they are looking to see that, that their investment is going to make money for them. They want to see that there's a floor, which are your public dollars, and that there's a healthy middle on which they can rely to make sure the investment is doing what it's supposed to do. This is going to take a little bit, I think, for us really to get into this, but it's definitely the next place for us to consider going, particularly as we look at some of the projects that we have across the markets in which we serve, some being right here in Baltimore. That would be a great example for a project like this. So I'm excited. I think this is a great opportunity for the health system to kind of to move into this next phase and become even more sophisticated in what it's doing.
So I would just encourage folks that if you live in a significant urban area, these are ways to maybe stimulate economic development that is inclusive more so than other approaches. So you just keep that in mind.
Thanks, Ed. Yeah. So like anything that you do, there's always challenges and there's always lessons learned. I think one of our challenges at this point is really trying to find continue sourcing investments in the community in which we serve, particularly through intermediaries, which is why the direct option is starting to look more attractive. Our CEO has very strong passion for serving either our global ministries and or our communities here domestically. And then there's complexities that emerge as this program grows. It's the record keeping of it. It's making sure all your documents are up to date. It's making sure you're getting paid when you're supposed to. It's really resources. And a lot of the reporting that this program we produce for this is ad hoc. It's done on spreadsheets. So there's always that risk of, the person who knows that spreadsheet the best, that key man risk of what if they get hit by the bus that day on the way to work. So, there's a lot that goes with that. And I don't know if you had other challenges you wanted to mention.
No, and we addressed, I think, some of those challenges, Pam, because we split the responsibilities between both our Treasury services and our mission services at Bon Secours. But this is, and I recognize various faith organizations may have this as an FTE or one person's responsibility. But as Pam said, sometimes sharing the responsibilities helps mitigate some of the challenges.
Mm-hmm. And then lessons learned. I think, speaking, historically for Bon Secours, as I said, right about the turn of the century, we made one investment through the Small Business Administration, and it turned out very bad. So we learned that diversifying our investments was a much better option for us. So we spread that risk across multiple counterparties, if you will. And then patience. You can see it's taken us 10 years to get where we're at today, and I think we have a phenomenal track record, and the work that has been done is just exceptional. But we didn't do it overnight, and we don't want to do it overnight. We want to make sure that we keep that focus on making meaningful, high-impact investments in projects that, again, can promote the health and well-being of the communities in which we serve.
Thanks, Pam. I think we're going to open it up because there are probably some questions out there that people may have or comments, and we welcome some alternative thinking as well.
Jake, you're still on mute.
Thank you, Matt. So we have some questions in the Zoom webinar chat that we're going to work through sequentially. If you have anything to add, you can also raise your hand if you'd like to just ask your question verbally. But to start off with, does Bon Secours, from Kelly Green, my colleague over at Greystone, does Bon Secours include the 5% as part of their total portfolio? And is the protection of capital that you have within that 5% also applicable to the 95% of total investable assets?
Great question. It is included. The 5% is included in our total portfolio, both from an asset allocation perspective as well as in a total return. The 95% that's in the pool, we obviously set out a risk return structure that we want to follow, and it is not subject to full protection of capital. We're broadly diversified across multiple asset classes.
Great. And then from Frank Sherman, who's with Seventh Generation, the ICCR group that many are likely familiar with. One question he had is, what's the expertise and overhead costs associated with the community investing effort?
Ed, do you want to take that?
So that's a good question. I think it's possible, both, Ross, my colleague in Treasury, obviously has a strong financial background. I had an MBA in the Mission area. At the same time, though, I think these are roles that people can be educated towards. And there are in many congregations, there's usually an individual with at least a financial bent or some discipline that can, in effect, do the spreadsheet pieces of it. It's the evaluation of, if you go the direct investment route, it's the evaluation of the individual investment that becomes complicated. And I would, per Pam's comment early on in our first investments, I said this, I used to say we became something like venture capitalists. So we're really pretty good at evaluating healthcare opportunities, but when we got outside of our sweet spot, it becomes problematic. So if somebody from an expertise perspective, this is why you use CDFIs, who can vet an individual project and the likelihood that it will succeed.
Great. Pam, did you have anything you wanted to add to that?
I would just say that I think what also helped with our journey, this 10-year journey, was as our treasury shop, when I came to Bon Secours 13 years ago, we really didn't have a true treasury operation, which over the years we've developed and it's become more sophisticated, which really helped, I think, us then leverage kind of that expertise and helping with the vetting and the due diligence, if you will, of these and community investments.
Great. So we have another question from Rabbi Jacob Siegel, who's with the J-Lins Investor Network, and he asked, did you encounter challenges early in the process getting board, investment committee, et cetera, on board with this initiative, and how did you overcome those challenges?
Pam, do you want to start or do you want me?
Go ahead, Ed.
So I think philosophically, we'll go back to the first, there was a desire to be intentional. I would say that the community, the congregation of Bon Secours, wanted to find a way to accomplish this. We know many Catholic congregations that use a portion of their investment for community investment purposes. So we were looking, and we also know that there were other health systems that had stepped into this space. So the underpinnings of it made sense, but the process by which we had to, the implementation of it, it was certainly, we had two different experiences with that. So when we didn't succeed the first time, and we found that that was problematic, we had to take a time out and rebuild the thinking around what was the right approach to get started with this. So that being said, I would say on the whole, as a Catholic institution, board members are inclined to find ways to pursue this integration. So I'll leave it at that.
Right. I'll just add to that. Think about the timing of when we started this program. This program was beginning on the cusp of the great financial crisis. So, we were making our first investments in 2008 when the whole capital market in the world, as we knew it, was imploding. So it was a little bit, scary, if you will, for our CFO to say, yes, you can give our money to somebody who we're going to entrust it with and hope they do good with it and get it returned one day. So, timing, I think, can be everything. But we persevered, and here we are today.
To that point, I just add, so after the first couple of years of investing, I think it was the 2009 report, Ross and I got to come to the Pension Investment Committee. That's who we report to on this. And we were able to demonstrate 2.5% return, whereas Pam was speaking to trying to bring from underwater a variety of other investments that we had. So it was actually, the timing and in terms of justifying the program was actually quite nice.
Mm-hmm.
I have a question a little bit about that return, particularly as a healthcare system. Have you done any kind of modeling or work on understanding the impacts, the financial impacts of these investments on the core business, the kind of health risks of the populations that you serve, or other, more clear linkages to social determinants?
That's a great question. And therein lies so our expectation with the CDFIs is that they produce a report to us annually on presumably the impacts, not the financial impact or return, but the returns to the community. Clearly, in the case of affordable housing, we know how many units and how many lives are transformed by being able to live in an affordable housing. When it comes to economic development, you're kind of trying, and I referenced the catalytic kind of efforts, you're trying to create ripples that have longer term impact across the community. So our expectation is the more that we do transformational investments in communities, the more likely that you could say crime rates decline, the more opportunity there is for transportation to come into that community. So we're trying to be opportunistic creators with our investments. But all our CDFIs have to report to us, and I'm very pleased about some of the smaller ones because we're very intentional about the programs or the lenders that they attribute our funds to, and they're very good at reporting to us. And we put out a report every 3 years talking about how our money has helped to transform communities.
That's helpful. There's another question that just came in that from Kelly Green again. It says, the due diligence on these and all investments is critical. Would the speakers discuss how the allocation of internal resources in Treasury and Mission might compare to other health systems in a traditional investing structure? So I guess there was a couple questions around resource allocation and basically overhead of these processes in Treasury and Mission. Can you speak to that a little bit?
Do you want to talk about Treasury?
Sure. So Ross Darrow, who was with us until about a month ago, he dedicated, he was our manager, our director of kind of investments. So his whole role here at the health system was really overseeing the day-to-day operations of the investment portfolio. So I want to say, depending on the time of year, but, it could be sometimes was up to 10 hours a week of his time, other times maybe, a couple hours a month, just depending on kind of where we were in the investment cycle. I think the thing that I would say is once you kind of get the program stood up and you get basic processes and procedures in place, the time that he had to dedicate would take less. Now, the time that he and Ed spent in sourcing investments, that would take more.
Yeah, and from the mission side of it, this was one piece of the job description. So there's community benefits, there's healthy communities, there was IRS reporting on Schedule H, et cetera. And we're in my, I'll say, portfolio of responsibilities. The first year we spent a fair amount of time, mostly over the summer, creating the documents and standing up the program. But that being said, we committed to making our investments, say, on April 1 and October 1. We did all our vetting in the fall and winter and sourcing opportunities as well as follow-up conversations with those that already had our funds. So there were, as Pam alluded to, there were probably some weeks where it was, 10 or 11 hours of our work. And then I would say there were whole months where it was simply, responding by occasional email. And that's how we wanted it because we had other responsibilities.
And then one other question from Frank Sherman. Are private investors taking advantage of public and foundation investment in those multi-investor projects to make better than market returns? So when you're talking about that capital stacking, are you seeing private investors kind of coming in to try and take that last best risk-adjusted return tranche?
I would say I think the thing that's missing in this whole field is trying to find those investors and trying to get a pool of them. I have this vision that someday will be a pool of private investors that you can access to draw on to support these projects. That's what I think the piece is missing. I think there's probably private investors out there. They just don't know where to go to try to do this work. Ed?
Yeah, thanks, Pam. So I think it's a local private investor, so to speak. It may be, and probably Frank Sherman's one of those people in Milwaukee. If there's an opportunity, and I'll use a metro system, for example. In DC or in Boston, periodically, every couple of years, there's a new stop that's on the metro line that's being created. And most of the studies indicate that these are highly attractive areas or zones for commercial development. The trick is to allow all classes of people, so to speak, to be able to have access to that. And so you will find developers who want to be there. The trick is to find those who are willing to say, okay, I want to put 10 or 15% of the residents for the commercial economic space aside for local residents, and that's why you need the second or the middle tranche as well as the lower tranche, because you're offsetting in essence what they may be doing. But they're there. There are commercial developers that want to do good as well as do well.
So Frank Sherman's official response to that is, quote, "You're killing me, Ed," end quote. So I think an appreciative, honest response. I know we're coming up towards the end of time, so I want to just kind of finish out with a question we oftentimes like to ask folks, and then I'll make some wrap-up comments, which is, for wherever the individuals on the call are on their impact journey, what's the one piece of advice from your experience that you would like to share with the broader group?
I would say patience and perseverance. Give yourself ample time to get this going, and the reward, I think, is great in the end.
Yeah, and thank you, Pam. And my comment aligned with that, complementary to it, is that it's doable. So lots of times individuals and organizations are, I'll say, financially adverse, or they don't want to have to deal with finance. But this is a great opportunity. And if you start small and be methodical, again, you don't have to have a PhD to step into this opportunity. And it can be very rewarding for an organization.
Well, I just want to thank Ed and Pam again. Really appreciated your comments and you both making the time to speak to the group assembled. For those of you interested in keeping involved in Seek, I hope you have signed up for the website for regular updates. We're also going to be doing a bigger push for regional gatherings moving forward. So there's one in West Coast towards the end of the month, as well as one in the Midwest that should be happening in the fall. So we're looking forward to both of those conversations. Hope you can join us. And if you personally have a story to share with your institution, feel free to reach out through the website info@catholicimpact.org. We're always interested in hearing from different types of institutions about what their impact journey has been like. So with that, thank you all so much for attending. Matt, do you have anything to add?
No, thank you, Ed and Pam. This has been really wonderful. I appreciate you being here today.
Thank you for having us.
Thanks a lot.
Okay, thanks everybody. Have a great day.
You too. Bye.